Hi, so let's start with malignant tumors of connective tissue origin. Fibrosarcoma is the first one. Malignant neoplasm of a fibroblast. This is fibrosarcoma is malignant neoplasm of fibroblast. Spindle cell tumors of fascicular architecture. Okay. Malignant spindle cell tumor of fascicular architecture, variable collagen matrix production showing fibroblast or myofibroblastic differentiation. Okay, this is the definition of fibrosarcoma. Malignant spindle cell tumor of fascicular architecture renewal. Variable collagen matrix production showing fibroblast or myofibroblastic differentiation. Then malignant fibroblast shows increased NC ratio, nucleocytoplasmic ratio, nuclear hypochromatism, nuclear pleomorphism, increased mitotic figures, abnormal increase. Histological features are herringbone pattern, streaming fascicules in fibrosarcoma, increased atypia, high grade, between, intermediate grade. Okay, these are the three types. Increased atypia means high grade. Okay, between means intermediate grade, and decreased atypia, atypical features are low grade. Okay, then clinically rapid growth, two types. There are of fibrosarcoma two types, primary and secondary. Primary is de novo, means occur on its own, and secondary is secondary to some pathology. Okay, then fibrohistiocytoma, it's storiform crisscross pattern. Storiform crisscross pattern seen in between benign and malignant neoplasm. Okay, it is like in between. It's a neoplasm, but in its features are in between benign and malignant. Okay, here it's more aggressive than the means it's more aggressive than benign, but less aggressive than malignant. Okay, then it shows this multinucleated giant cell, which are called as Tauten giant cell, which is like which has a feature of nucleus at periphery. Okay, then fibroblast and histocytes are proliferating here. Fibroblast and histocytes. Foamy cells. Histocytes appear as foamy cells, foamy lipid laden histocytes. Differential diagnosis from giant cell, Langerhans giant cells. Its differentiating feature is from Langerhans giant cell and fibrous histocytoma is that Langerhans giant cells have horseshoe pattern of nucleus arrangement, and Tauten cells has periphery. Then hemangiopericytoma, staghorn pattern of branching vessels, pericytes, cells which support blood vessels. These hemangiopericytoma has a staghorn pattern of branching vessels. Pericytes cells which support blood vessels. Pericytes are the cells which support blood vessels. Then compressed blood vessels can also be seen first in SMF and second in hemangio. Compressed blood vessels seen here. Hemangiopericytoma. Then compressed odontogenic follicles seen in desmoplastic ameloblastoma. Compressed odontogenic follicles. Odontogenic follicles seen in desmoplastic ameloblastoma. Kite or animal shape. Then Kaposi sarcoma. Multifocal proliferation of spindle cells, vascular cells, multiple idiopathic hemorrhagic sarcoma of Kaposi. Kaposi sarcoma, multifocal proliferation of spindle cells, vascular cells, multiple idiopathic hemorrhagic. Kaposi sarcoma is multifocal proliferation of spindle cells plus vascular cells. Multifocal proliferation of spindle cells. Kaposi sarcoma is multifocal proliferation of spindle cells and vascular cells. Multiple idiopathic hemorrhagic sarcoma of Kaposi. Multiple idiopathic hemorrhagic sarcoma of Kaposi. Most common type is classical type. By the way, there are four types. Classical type, which is also called as chronic type, endemic or African type, associated with immunosuppression, and AIDS associated means fourth type. Classical type or chronic type is lesions over skin as red purplish patch or nodule. Lesions over skin which has red purplish patch, then it will convert into plaque and then in nodule. An endemic African type lymphadenopathy, not associated with AIDS. Endemic African types have uh, is a type which is not associated with AIDS patients, lymphadenopathy, associated with immunosuppression. Third is associated, which has endemic type have lymphadenopathy. Then third one is associated with immunosuppression. Grafts patient undergoing associated with immunosuppressions or grafts patient undergoing grafts. Okay. Then fourth one is associated with the AIDS. Okay, fourth type. Most common intraoral site is in palate, Kaposi sarcoma, then gingiva. First is palate, okay, remember that. Then associated with HHV, herpes, human herpes virus 8, okay, human herpes virus 8. Kaposi sarcoma is associated with human herpes virus 8. Then histologic features are divided into three stages: patch, plaque, and then nodule. Patch, then plaque, and then nodule. Okay, a patch has increased proliferation. Proliferation of capillaries are seen, slit-like spaces, few spindle cells. Okay, then plaque and then nodule increase spindle cells, plus split-like spaces. Increase spindle cells plus slit-like spaces. Ewing sarcoma, commonly seen in young children, belong to category of round cell neoplasm. Ewing sarcoma is commonly seen in young children, belong to the category of round cell neoplasm, affect children and young adults, primarily affecting bones. Similar tumor histopathologically soft tissue counterpart of Ewing sarcoma is called as PNET, primitive neuroectodermal tumor. Okay, round shaped tumor cells arranged in filagrine pattern or embroidery pattern. Mm, contain cytoplasm which is rich in glycogen, Ps positive. Contains cytoplasm which is rich in glycogen, Ps positive. Osteophyte formation which is composed of sundry appearance, also seen in osteosarcoma. Also onion skin appearance. Periosteal bone formation. Radiographically, histologically, filagrine pattern is seen. Okay, soft tissue, counterpart is peanut. Okay, round cell tumor it is seen in children and young adults, primarily affecting bones. Okay, radiographically we see sundry appearance because of osteophyte and also onion skin appearance because of periosteal bone formation. Then treatment is through though radiosensitive, still though it is radiosensitive, still surgery is preferred choice associated with chemotherapy. Though it is radiosensitive, Ewing sarcoma is radiosensitive, still surgery is the preferred choice. An osteosarcoma or osteogenic sarcoma, most common second malignant neoplasm of bone after multiple myeloma. Okay, most common second malignant neoplasm of bones after multiple myeloma, seen in children and young adults. In them, most common malignant lesions are lymphomas, brain tumors, and osteosarcoma. First is lymphoma, second is brain, and third is osteosarcoma. The osteosarcoma is if you have read that novel or seen the movie of John Green. John Green is the author of that novel, The Fault in Our Stars, in which the guy, the main hero, whose name was Augustus, he has the disease. osteosarcoma. He was like 25, 27 years old. Okay, फिर mesenchymal bone forming tissue. Osteosarcoma, malignant neoplasm, Okay, seen in children and young adults, in them malignant lesions are lymphomas, brain tumors, and osteosarcomas. Malignant neoplasm of mesenchymal tissue, mesenchymal bone forming tissue, embryonic connective tissue, immature connective tissue are proliferating, so they form tumor osteoid. Abnormal bone formation. Tumor osteoid is abnormal bone formation. Osteosarcoma clinically. Central surface extraskeletal. Tumor, they form tumor osteoid, which is abnormal bone formation. Clinically, osteosarcoma are divided into three types: central, surface, and extraskeletal. Central is intramedullary, within bone, which is inside the bone. Surface is juxtacortical or over surface of the bone, and extraskeletal is in soft tissue. Okay, so surface, which is over the surface of bone, juxta cortical, is are of two types: periosteal or periosteal. Periosteal is the above the periosteal is this one above the surface of the bone, and periosteal is below periosteum. Okay, then central is intramedullary, inside the bone, deep inside the bone. First type is conventional. Conventional type has three types. Conventional variant has three types: osteoblastic, chondroblastic, and fibroblastic. All are blastic: fibro, chondro, and osteo. Bone, cartilage, and fibrous. Then rare variants are telangiectasia, small cell, etc. Okay, but all associated with osteoid. Tumor osteoid, all are associated with osteoid formation. That's why histological marker is osteoid. Okay, osteoid is the histological marker of osteosarcoma. Chondrosarcoma, how can we differentiate from chondrosarcoma also from osteoid? So how differential diagnosis? Can't see osteoid formation here. Chondrosarcoma is also similar to osteosarcoma, but there is no osteoid formation. Okay, that's how we differentiate between osteosarcoma and chondrosarcoma. Then oral manifestations are most commonly seen in jawbone. Site is jawbone, most common in mandible, very most common in maxilla. Then age is 27. Augustus Waters was his name. Okay, The Fault in Our Stars. And 10 years later, then 10 years later, then extragnathic side, tibia or femur, 10 to 25 years. Okay, age is 25 years, 27, sorry, 27 years, means after 25 years later, extragnathic side are involved, like tibia or femur. If it had occurred at the age of 10 to 25 years in mandible, then, or at gnathic side, then 10 years later extragnathic side is involved. Augustus had osteosarcoma in the, I guess, in the leg, in his leg portion of the body. So maybe at 25 27 years. Jaw after 10 years. Okay, jaw swelling is causes facial asymmetry associated with acute extreme pain, rapidly growing, so prognosis is poor. Radiographical features is sunburst or sunray appearance, we all know that. Since tumor osteoid is formed, which is an abnormal bone formation, IOPA, so it will show sunray, sunburst appearance. Okay, IOPA shows abnormal thickening of pedial space, also seen in scleroderma, abnormal thickening of pedial space. Then in long bones, cumulus cloud or Codman's triangle, acute angle in bone is seen. Cumulus cloud or Codman's triangle. Cumulus cloud or Codman's triangle is seen. Okay. Then histological hallmark is tumor osteoid and malignant osteoblast. Malignant osteoblast, which is atypical features of osteoblast. Then staging of osteosarcoma are divided into two types. Stage 1 to 3 and stage AB. Stage 1 is low grade, 2 is high grade, and 3 is metastatic. Worst prognosis, which has. And then A is intramedullary, inside the intramedullary side or extramedullary side. Primary side is more closer to, like primary side is more closer to the center, the more poorer will be the prognosis. The more closer to the center, that lesion, osteosarcoma, the more closer to the center of the body, the more poor will be prognosis. That's, you know, that's obvious. Distal extremity has best prognosis. Femur intermediate, which is intermediate prognosis. And then axial means, thoracic part, abdomen, axial or shoulder part, has worse prognosis. Then malignant lymphoma, group of neoplasm which increase cells of lymphoid origin, lymphocytes and histocytes, seen in different state of maturation. Group of neoplasm which increases cells of lymphoid origin, lymphoid, malignant lymphoma it is, so it will increase cells of lymphoid origin, okay, like lymphocytes or histocytes, which are seen at different stages of maturation, okay. Then there's 2001 real classification: B cell neoplasm, T cell neoplasm, or NK cell neoplasm, or Hodgkin's disease. Okay, this is the chart and not much important. Means just read. Okay, B cell neoplasm, mantle cell lymphoma. It has mantle cell lymphoma, follicular lymphoma, hairy cell tumor, diffuse large B cell lymphoma, and then Burkitt's lymphoma. B for Burkitt. Okay, and then these four: mantle cell lymphoma, follicular lymphoma, hairy cell tumor, and then diffuse large B cell lymphoma. Then T cell or NK cells. T cell chromic lymphocytic lymphoma, T cell granular lymphocytic lymphoma, chronic granular, chronic and mycosis fungoides. Mycosis fungoides is T cell lymphoma, not T cell neoplasm. Adult T cell lymphoma, aggressive NK cell lymphoma. Okay. Then Hodgkin's disease is nodular lymphocyte predominant Hodgkin lymphoma, nodular lymphocyte predominant Hodgkin lymphoma. Classical Hodgkin lymphomas: nodular sclerosis, lymphocytic rich, mixed cellularity, and lymphocyte depleted.